Very good evening. I hope all of you are doing well. Yes, a quick note whether the audio visual is good. Yes, guys, waiting for a quick note whether the audio visual is good there. Hi, happy evening. So I can see at least कि ठीक है, the visual is okay. All right. So hi, happy evening, Manisha, Divya, Asha, Cotton Shoes, right, my family members here. Thank you, Asta, for that nod. So today we are going to discuss a very important topic, that is the functional columns, the functional components of the cranial nerves. This is a topic which many students have been requesting for, and we are going to decode this topic like in a very easy way, because it's actually very easy. If we get to the concepts, basically what do the terms imply, then it becomes very easy. I have discussed it in one of my plus courses as well. So we'll be discussing the theory part of it. Please go back to that session and solve the MCQs from there. Okay, it's very important to solve the MCQs also. If you are not on plus, you can solve the MCQs from any other resource that you have, right? So before we start, I hope all of you have watched the previous sessions also that I have taken this month. Quite a few sessions I have taken. In the special classes, we have had the entire Live at 5 series, the NEET PG Essentials. Each of that session is important. If you have missed any of that, please go back and check that. On the YouTube, we had amino acid derivatives. With mnemonics, we have seen. We have seen the tips on how to review the GTs, you improve your GT scores, and we have seen the culture media with some amazing mnemonics, right? And these are the topics that we have covered in our special classes this month. Please look at the topics. If you think that any of your topic is you feel you are not confident about, please go back and check that session on the Unacademy app. These are free sessions. They are available as recorded sessions, so you can watch them even now. And I hope all the plus subscribers or our future plus subscribers are aware of the ongoing the plus courses that are going on. So we have started with intensive revision batch for NEET PG 2021. Not only that, even we have started for next 2022 batch. We are starting another batch for next 2022 on 21st of December. And I would be catering to your radiology subject in this course. So it's going to be 6 hours per day, and we'll be completing radiology in just 3 days. So this is like the best platform, just like offline classes, you would be completing subjects in a stipulated time. That's the best part of it. So apart from that, all the plus subscribers, please watch the previous courses that I have taken. Last year NEET PG 2020 revision courses are still available, which I have taken quite a few high yield topics. Many of you would vouch for it. If you have watched those sessions, they are extremely high yield. And plus subscribers, you know the benefits. You have the daily live classes. You have the structured courses, much better structured courses in the coming year. You have live polls, and you have unlimited access with one subscription. Iconic subscription. What is Iconic? It is a combination of Unacademy and Prep Ladder. So you get the best resources of live and the recorded sessions both, along with the question bank and the rapid revision of Prep Ladder as well. And yes, the free quizzes, like which are making a lot of noise everywhere, the free quizzes on the Unacademy app. Every day you have 8 p.m. and 9 p.m. Apart from that, even I personally take your pre-test and post-test for the daily targets that we have on the Telegram group. So you have a quiz at 10 a.m. to assess your preparation for the daily target, pre-assessment, and then you study for the entire day. Again, we have a post-test at 10 p.m. So we share the links like just 5-10 minutes before your 10 a.m. and 10 p.m. Make sure you are making the best of it. The links are shared on my Telegram group and also on the Unacademy NEET PG Telegram group, right? So to see the special classes, guys, many students have been asking ki kahan dekhe special classes. When you go to the Unacademy Learning app, you will see that there is slight change in the app now. Instead of special classes, now they mention as free live classes. That is same as special classes. So go to the free live classes section to watch all the free sessions which are there. There's a huge resource there. And not only mine, but all educators' free sessions are available there. And you can use the code Dr. Nikita. If you're asked to activate the free classes, you can use this code for activating that. And also while you are subscribing, you can use the code Dr. Nikita for your additional discount. So while you are subscribing, you can use 6 months, 12 months, 18 months, depending on what exam you are targeting at. You can decide your period of subscription. I'm hoping to see you all on the Plus platform as well. And I've recently completed a course on the Plus platform where we have discussed very, very high yielding topics, right? So let's start with our today's class, which is the cranial nerve functional columns. We'll make it simple. As I told you, we are going to simplify it so that this topic, rather than being your most hated topic, it will become your most loved topic in neuroanatomy. All right. Ravi, the microbiology culture media part 2 will be coming soon, very soon, but not this month. Maybe we'll do it next month for sure. Okay. Dr. SLA, this video will be available for later viewing as well. You can watch it again and again as many times as you want. अभी start करते हैं your functional columns, the components of the cranial nerves. So remember that your functional columns can be either, they can be either general or they can be visceral. Okay, they can be general or they can be general या क्या रहेंगे? Special. They can be somatic, they can be visceral. They can be afferent or they can be efferent. Okay. So what do we need to remember? The columns can be general columns or they could be really special columns. The columns could be somatic. The columns could be visceral. What do we mean by these terms? Somatic means basically your voluntary control. Somatic matlab body. Soma matlab body. So they are under the voluntary control. When we say visceral, visceral means basically when we see visceral, we'll see that they would be your involuntary or basically your autonomic nervous system, the parasympathetic one. Not the sympathetic will not come here. Why the sympathetic will not come here? It will be parasympathetic which will come in your cranial nerves because sympathetic flow is what flow? It is thoracolumbar outflow, right? Your sympathetic is the thoracolumbar. Your parasympathetic is your craniosacral outflow. Even this is asked as a question, right? So your parasympathetic is craniosacral. That is why in the cranial nerves you would have parasympathetic. So your visceral columns will include your parasympathetic and they will include the muscles which are not your, they'll include the muscles which are not somatic or which are not general. I'll come to that column. Afferent and efferent. Afferent matlab हमको पता है, the sensory nerves are your afferent. Efferent means the motor nerves are going to be the efferent, right? Your mixed nerves will be both sensory and motor. Okay, your mixed will be both. So when I say your, let's say cranial nerve 3, your cranial nerve 3, which is your oculomotor nerve. What kind of nerve is this? Is it a sensory nerve? Is it a motor nerve? Or is it a mixed cranial nerve? What nerve is this? Your cranial nerve 3 is your motor cranial nerve, right? It's your motor cranial nerve. So motor cranial nerve means it will have which column? Will it have afferent column? Will it have efferent column? Or will it have both afferent and efferent? It is only motor. So that is why it will have efferent column. Okay, that is why it will have efferent column. It will not have afferent column. Okay, it will not have your afferent column. It will not have your afferent column, right? Now, your mixed cranial nerves, okay, your mixed cranial nerves, like let us say your trigeminal nerve, okay, the trigeminal nerve carries the sensations, it supplies the muscles also. So it will have afferent, and it will have efferent as well. So this is the number one basic point to understand. जो sensory है वो afferent होंगे, जो motor है वो efferent होंगे, right? Now coming to what columns do you have? Okay, what columns do you have? So if you do the permutations and combination, you can have column which is general, somatic, afferent, general, somatic, efferent. So you can have columns which is general, somatic, afferent, general, somatic, efferent. You can have a column which is general, visceral, afferent and general, visceral, efferent. So you can have general, visceral, afferent, general, visceral, efferent. You can have a column which is your special somatic afferent. It could be special somatic afferent, special somatic efferent. I'll come to this कि कौन सा column नहीं होता है. You can have a column which is special visceral afferent and special visceral efferent. Special visceral afferent and special visceral efferent. Out of these, tell me the 8 columns that we have made. Which column is not present? Which column is not present? Absolutely right, Bhuva. So it is special somatic efferent. Special somatic efferent is not present. Remember that there is no special somatic efferent. Okay, so total then how many columns do we have in total? We have 7 columns, right? So total we have 7 columns. Out of that, how many are afferent and how many are efferent? So you have 4 afferent columns. General somatic afferent, general visceral afferent, special somatic afferent, special visceral afferent. You have 3 efferent, right? So you have 4 afferent columns and 3 efferent columns. Clear with everyone? So we have total 7 columns. Out of that, 4 are afferent and 3 are efferent because there is no special somatic efferent. Remember, there is no special somatic efferent. Now coming to the discussion of each of the columns, like what do they mean? So when I say general, somatic, efferent, okay, when I say general, somatic, efferent. So this is a column. Number one, it is your efferent column. So it is going to be the motor nerves only. There would be no sensory nerve. It is your general somatic efferent, somatic muscles, voluntary muscles. So the voluntary muscles, basically the muscles of the eyes, the muscles of the tongue, and some books also include your trapezius and sternocleidomastoid, right? They also include trapezius and sternocleidomastoid. So these are the muscles which are in our control. We can regulate the movement of the eye muscles, the extraocular muscles, the tongue muscles, the sternocleidomastoid and the trapezius. So these will come under your general somatic efferent. These will come under your general somatic efferent. So obviously, which are the nerves that will come? Your extraocular muscles are supplied by which cranial nerves? Your cranial nerves 3, 4, 6, right? We know 3 supplies all the muscles except your SO4 and LR6. Superior oblique by 4th, lateral rectus by 6th. So that is why 3, 4, 6 is your general somatic efferent. Tongue muscles supplied by your hypoglossal nerve. Majority of them except palatoglossus. So that is your 12th cranial nerve will come in the general somatic efferent. Sternocleidomastoid and trapezius we saw yesterday in the neck triangles, your accessory nerve. So your 11th cranial nerve will also come in your general somatic efferent. So just remember, it is very easy to understand. Efferent matlab motor, supplying the muscles, and supplying the somatic muscles, that is the muscles which are under our control. Similarly, when I will say this is general somatic efferent, when I say general visceral efferent, when I say general visceral efferent, so again it is going to be the motor component, it is efferent and it is visceral, okay, and it is visceral. So when I say general visceral, It is basically your parasympathetic outflow. And we all know that which are the parasympathetic cranial nerves? Yes, which are the parasympathetic cranial nerves? Yes, so it is your 3, 7, 9, 10. It is your 3, 7, 9, 10. So these are the nerves which will come under your general visceral efferent. Now 3, 7, 9, 10, what are the nuclei which are there? The parasympathetic nuclei, what are they called as? 3, 7, 9, 10. Let us have a look at the nuclei because it is important. Which are those nuclei? So the third nerve supplies your parasympathetic to the ciliary ganglion. The nucleus is your Edinger-Westphal nucleus. Okay, so third का होता है Edinger-Westphal. Easy to remember. Number 3 उल्टा कर दो अल्फाबेट E हो जाएगा. So Edinger-Westphal nucleus is the parasympathetic nucleus of cranial nerve 3. 7 and 9 you have salivatory nucleus. 7 is the superior number, so superior salivatory nucleus. 9 is your inferior salivatory nucleus. So you have superior salivatory nucleus, you have inferior salivatory nucleus. Alright, 7th का आपका आता है lacrimatory as well. All the glands of the face are supplied by your 7th except which gland? It is not supplied by the 7th cranial nerve. The parotid. जो सबसे नीचे gland है वो याद रखो except your parotid. Parotid is not supplied by the 7th. Parotid, remember, is नीचे. It is supplied by the 9th. That is, you have otic ganglion. Otic ganglion से आता है. We'll see some other time the ganglia in the head and neck. So, the trick to remember is that parotid, otid is supplied by your otic ganglion. It is your otic ganglion. Okay. बाकी जो आपके हैं वो होता है टेरिगोपैलेटाइन गैंग्लियन और सबमैंडिबुलर गैंग्लियन, वो सब होते हैं. अभी आपका cranial nerve 10, which is the nucleus of cranial nerve 10, parasympathetic. The efferent nucleus is your dorsal nucleus, dorsal motor nucleus of the vagus nerve. Remember that the dorsal nucleus is the efferent nucleus of the vagus. That is what is included in your parasympathetic outflow. So now we know that general visceral efferent is your parasympathetic. That is what we need to understand. As easy as that. Visceral is parasympathetic, general visceral. Then what is your special visceral efferent? What is special visceral efferent? Let us see what is special visceral efferent. Again, it is efferent, it is motor, and special visceral is the term which is used for your branchial arch muscles. Okay, so it is basically your pharyngeal arch or the branchial arch muscles. We have recently discussed in our embryology special class branchial arch derivatives mein. You have 6 branchial arches. Out of that, the 5th one regresses, does not contribute to development. So you have branchial arch 1, 2, 3, 4 and 6. Which are the corresponding nerves for these branchial arches? All your mixed cranial nerves, right? We start with number 5. Odd numbers 5, 7, 9 and the lower 2, 4 and 6 are by your 10th. And you have plus few fibers coming from the 11th cranial nerve as well. Few fibers come from the 11th, that is the accessory nerve. So branchial arch, if you know the nerves 5, 7, 9, 10 plus few from 11. So these will be your special visceral efferent. So 5, 7, 9, 10, 11. These would be your special visceral efferent. And what is this nucleus called as, where you have cranial nerves 9, 10, 11? Which nucleus is this called as? 9, 10, 11 is your nucleus ambiguous. It is your nucleus ambiguous. So nucleus ambiguous 9, 10, 11 component of your special visceral efferent. Okay, special visceral efferent. So we are done with special visceral efferent. Easy है. Branchial arch सिर्फ आपको याद करना है. You know branchial arch 5, 7, 9, 10 and few fibers from 11. What is remaining now? What is remaining now? Your general, let's come to the afferent columns. The general somatic afferent. Okay, the general somatic afferent. So these are the nerves, the columns. Afferent matlab sensory, and they are general somatic sensations. That means the sensation from the body, from the skin, the joints, the muscles. This would be your general somatic. Your general visceral afferent would be from the viscera. Okay, that would be from the viscera. So we know that general somatic from the face, your sensations of pain, touch are carried by which nerve? They are carried by the trigeminal nerve. That is why you will have cranial nerve 5 in your general somatic afferent. You will have cranial nerve 5 from general somatic afferent. Some books also include the sensations from the ear carried by your cranial nerve 9, cranial nerve 7, cranial nerve 9 and cranial nerve 10. So they include 7, 9, 10 as well. But remember, most important is your 5th, the sensations from the face. ये हो गया general somatic afferent. So general somatic is basically your pain and touch, these sensations. What is general visceral afferent? Okay, just stay with me. We will quickly revise this at the end. In 5 minutes, everything will be clear at the end. Okay, just understand the concepts now. General visceral afferent. It is afferent, so sensory. General visceral means from the viscera. It carries the general sensations from the viscera. So you have the sensations which are carried from the pharynx, the general sensation from the tongue, all of those. So remember, here you have your nucleus tractus solitarius, the cranial nerves 7, 9, 10. Predominantly in general visceral is your cranial nerve 9 and 10, which carry the sensations from your pharynx, which carry the sensations from your the carotid body, the carotid sinus, wahan se 9 or 10. What is included in your special visceral afferent? What is included in your special visceral afferent and special somatic afferent? What is the difference between the two? As the term says, these are your special afferent columns. So they are going to carry special senses. They are going to carry your special senses. Now what are the special senses? Your hearing, okay, okay. Then you have your taste, your olfaction and optic, the vision, cranial nerve 1 and 2. Some books include, some books do not include, because these cranial nerve columns are basically for the cranial nuclei which are in the brain stem. Midbrain, pons and medulla. And we know that the brain stem, midbrain se start hota hai aapka cranial nerve 3. That is why many books they exclude your cranial nerve 1 and 2, even though they carry the special senses, but from the columns they are excluded. So we start from cranial nerve 3 and we go up to cranial nerve 12. So what is included in your special visceral afferent and special somatic afferent? In your special visceral afferent, you have the taste sensation. Somatic afferent is your hearing. Okay, so hearing is the special sense. आपका smell और vision हमने बोला कि नहीं include करते हैं. So taste we know is carried by what? Taste fibers finally go to your nucleus tractus solitarius. Which are the cranial nerves in nucleus tractus solitarius? The term itself tells you 9, 10 and 7. So nucleus tractus solitarius has 9, 10, 7. So 9, 10, 7, these become your special visceral afferent, similar to your general visceral afferent. Okay, and your special somatic afferent, hearing, is your cranial nerve 8. So vestibulocochlear nerve, that nucleus will come under your special somatic afferent. Okay, that will come under your special somatic afferent. So if you see, we have completed these your columns. What I want to do now is just make a table. Okay, I hope all of you are doing that as well along with me, so that you are done with this topic. Let's make a table and we write down your cranial nerves. Okay, we write down the cranial nerves We write down the columns. What columns? General somatic efferent. We write down general visceral efferent. We write down special visceral efferent. We don't have special somatic efferent. We have general somatic afferent. We have general visceral afferent. We have, what else do we have? Special somatic afferent. And we have special visceral afferent. Okay, we have special visceral afferent. And let us write down the nerves here. Let us write down the nerves here. 1 and 2 we are not including. We are starting from the brainstem. Cranial nerve 3, 4, 5, 6, 7, 8, 9, 10. And we have 11 and 12. Okay, and we have 11 and 12. So let us make this table and complete this table. Let us just consolidate everything in this table. Alright. तो ये टेबल में हम पूरा लिखते हैं कि कौन से नर्व में कौन सा कॉलम आएगा. You guys will tell me now which nerve will have which column. Alright. So let us start with the table. Let us start with the table here. एक बार क्विकली रिवाइज करते हैं कि कौन से कॉलम में क्या क्या आता है. जनरल सोमैटिक efferent is your muscles of eye, muscles of tongue, trapezius and sternocleidomastoid. What is general visceral efferent? Is your parasympathetic. It is your parasympathetic. What is special visceral efferent? Your branchial arch muscles, the branchial arch muscles. What comes in your general somatic afferent? General sensations, pain, touch, temperature. General visceral afferent, the general sensations from the viscera like your pharynx and all. Special somatic afferent, that is the special somatic, bahar wala sensation, hearing, the special sensation. Special visceral afferent is your taste sensation. That is your taste sensation. So once you know this, now we can complete the table here. Alright. So let us complete the table. Here you have cranial nerve 3. Cranial nerve 3. What does it carry? Cranial nerve 3. Just give me a moment, guys. Yes, your cranial nerve 3, it supplies your extraocular muscles, which are voluntary muscles. That means somatic efferent, right? It is the general somatic efferent. So you will have general somatic efferent. What else does the cranial nerve 3 have? What else does the cranial nerve 3 have? Very good. That is your general visceral efferent, because your parasympathetic outflow, which is Edinger-Westphal nucleus, Let us see the other one. Let us see the other one. Cranial nerve 4. Cranial nerve 4. Cranial nerve 4 supplies your SO4, superior oblique extraocular muscle. It supplies your SO4. So this is your general somatic efferent, right? It is your general somatic efferent. What will the cranial nerve 5 carry? Cranial nerve 5 is your mixed cranial nerve. Carries the general sensations. So general somatic afferent. It is efferent mein. It supplies, it is the nerve of the first branchial arch. Branchial arch is your special visceral efferent, right? It's your special visceral efferent. Cranial nerve 6. What will cranial nerve 6 do? LR6, extraocular muscle. So it is your general somatic efferent, right? It is your LR6. General visceral efferent में आएगा? नहीं आएगा. उसमें 3, 7, 9, 10 आता है. Special visceral efferent 5, 7, 9, 10, 11. General somatic afferent predominantly cranial nerve 5. General visceral afferent, special visceral afferent 7, 9, 10. Special somatic afferent cranial nerve 8, right? अभी cranial nerve 7 देखते हैं. How about your cranial nerve 7? How about your cranial nerve 7? Let us see one by one. General somatic efferent. It does not supply your eye muscles, tongue muscles. यहाँ पे supply नहीं करता है. General somatic efferent नहीं आएगा. General visceral efferent, parasympathetic, 3, 7, 9, 10. Yes, it will come here. Special visceral efferent, 5, 7, your branchial arch, it will come there. General somatic afferent. We said some books include in your general somatic afferent your general sensations from the ear, so they do include it. General visceral afferent, it is your 9 and 10 predominantly, which carry the sensations from the viscera. Special somatic, no, it is cranial nerve 8. Special visceral, taste. We know the anterior 2/3 is your taste sensation. It comes there. So 7 में आपके 4 columns आते हैं. The cranial nerve 7 has 4 columns. Clear with everyone? Right? Vestibulocochlear, cranial nerve 8. It carries your hearing. Hearing is a special sensation. So this becomes special afferent, special somatic afferent or special visceral afferent. It is special somatic afferent. So cranial nerve 8 would be in your special somatic afferent. Cranial nerve 9. Let us see now cranial nerve 9. What all will it do? 9 general somatic efferent में नहीं है. General visceral efferent में है. 3, 7, 9, 10 parasympathetic. Special visceral efferent branchial 5, 7, 9, 10. General somatic afferent, yes, carries the sensations from here. General visceral afferent from the pharynx, the sensations are taken there. Special somatic, there is only cranial nerve 8. Special visceral afferent, nucleus tractus solitarius, your 9 comes there. So cranial nerve 9 will have 5 columns. It will have 5 columns. Cranial nerve 10. Let us come to cranial nerve 10. What will happen with your cranial nerve 10? It would be same like your cranial nerve 9. Does not supply the muscles, the somatic muscles. General visceral efferent, which nucleus? The dorsal nucleus of the vagus. Very important, it's the dorsal nucleus. Special visceral efferent, yes, branchial arch में supply करता है. General somatic afferent, yes, from the ear it comes. General visceral, yes, from the viscera it carries the sensations. Special somatic, no. Special visceral, yes. So it is same like your cranial nerve 9. So 9 and 10 are together. 11. Where does your cranial nerve 11 come? Yes, where will your cranial nerve 11 come? Quickly. Where will your cranial nerve 11 come? Yes, Moksh. Cranial nerve 11. So it is your motor nerve. So it will not be included in your afferent columns. It will not be included in afferent columns. It has to be in the efferent. General somatic efferent. General somatic efferent. Yes, it supplies the trapezius and sternocleidomastoid. General visceral efferent, it is not a parasympathetic nerve. Special visceral efferent, branchial arch. Yes, it is branchial arch. So it will be basically in general somatic efferent and special visceral efferent. Cranial nerve 12, your cranial nerve 12, it supplies the tongue muscles, it's a motor nerve, it will be only efferent. So general somatic efferent, it supplies the tongue muscles. It is not parasympathetic, it is not a branchial arch nerve, and it is not a sensory nerve, so it will not be included there. Some of you are saying that the 7th nerve is included in your general visceral afferent as well. Some books say yes, some books say no. The nucleus tractus solitarius is included, but in the nucleus tractus solitarius, they say it is just the fibers from your 9th and 10th nerve. Okay, 7th nerve, many books they don't include in the general visceral afferent. So, 7th ko nucleus tractus solitarius is included, the 7th is included or not. So this was about your cranial nerve columns. I think everyone is clear with this now. Where are your salivatory nucleus included? They are which cranial nerves? You have the superior salivatory, you have the inferior salivatory. Superior salivatory, remember, is all S, so it is your cranial nerve 7. Inferior is below that, it is your cranial nerve 9, glossopharyngeal nerve. These are your parasympathetic fibers. Parasympathetic are your general visceral efferent. Parasympathetic are your general visceral efferent. Yes. So just understand the terms. You need not mug up कि कौन सा column कहाँ आता है. You will be able to identify. A quick 1-minute review. General, somatic, efferent. Again and again I'm revising because this is the crux of the topic that you need to know. So you have 7 columns, right? You have 7 columns. Special somatic efferent is not there. So you have 3 efferent and 4 afferent. 3 efferent and 4 afferent. General somatic efferent is your muscles of eye, tongue, the sternocleidomastoid and trapezius. General visceral efferent is your parasympathetic 3, 7, 9, 10. Special visceral efferent is your branchial arch muscles. It is your branchial arch muscles. Afferent may general somatic afferent, your pain, touch, all of that. General visceral afferent, the general sensations from the viscera. Special somatic afferent is your hearing sensation. Special visceral afferent is your taste sensation. So even if you remember this much, you will be able to answer the questions on your cranial nerve functional columns. So I have not gone into the details of embryology. Basically, these columns are based on whether they come from the alar plate, the basal plate, where are they located and all. I have not gone into the details. This is the easiest way to remember your columns, right? This is the easiest way to remember your columns. So guys, I hope that this topic is now simplified for all of you. And you would be able to answer the questions on this. As I said, I have taken a session in the Plus course on your cranial nerve functional columns along with MCQs, right? Very, very important to test yourself once you have read a topic. Make sure you solve the MCQs on that. Please watch that session, solve the MCQs and master this topic forever. Alright, so I'll see you again tomorrow, that is 11 a.m. with the topic of age estimation from the wrist x-ray. We would be concentrating only on the wrist x-ray because many times you get an image on that. So tomorrow, that is 19th, right? 19th December, 11 a.m. It's going to be a short session. We will be seeing age estimation from the wrist x-ray tomorrow at 11 a.m. Alright? Where in Plus, I will let you know. I'll share the link, Moksh, in the Telegram group description. Also, you can find a PDF of the date-wise topics. You will find a session there. Okay. Tomorrow, YouTube. Yeah, it's the same platform. It's gonna be a YouTube live session tomorrow at 11 a.m. Okay, it's the same channel tomorrow 11 a.m. It's gonna be YouTube live. All right. Okay, so that's all for today, guys. I hope you've enjoyed this session, got to learn from this topic, the easy way to solve the questions on this topic. And I'll see you tomorrow at 11 a.m. Keep studying, keep revising, and keep winning. Good night.